Good afternoon. You have joined a webinar from the Maryland EMS for Children's program that is supported by Maryland Highway Safety on drowsy driving. Our presenter this afternoon will be Suzanne Ogaitis-Jones. There is a section in the bottom of the GoToWebinar where you can type questions and we will answer them at the end. At this time, I am going to change presenters to Suzanne Ogaitis-Jones and welcome her as our webinar faculty. Suzanne,
Hello.
they can see your screen and you have control of the audio.
Thank you. This presentation is adapted with permission from the National Road Safety Foundation's Almost Home training as part of a grant awarded by them and the Governor's Highway Safety Association to the Maryland Department of Transportation's Highway Safety Office. The Maryland Institute for Emergency Medical Services Systems received the grant and created a drowsy driving awareness and prevention campaign in 2017 and 2018, focusing on Maryland healthcare agencies. In addition to this presentation, other drowsy driving awareness and prevention materials are available to Maryland healthcare agencies to further increase awareness of this important topic. I'll talk a little bit more about this at the end of the presentation. So this is me. And when I'm not doing drowsy driving prevention education, I am coordinating the Child Passenger Safety and Occupant Protection Program at MIMS. Here are the goals of the presentation. I won't read them for you, but you can look them over. This presentation will include several short videos which interview real people to illustrate the drowsy driving profile and possible outcomes. And continuing education credit is available for Maryland EMS providers who view this presentation and answer a quiz. So let's start by talking about the problem of drowsy driving. The National Highway Traffic Safety Administration estimates using police crash data that there are about 328,000 annual drowsy driving crashes on U.S. roadways. About a third of those produce injuries, and they estimate that there's over 6,000 deaths a year associated with drowsy driving crashes. Now, because these numbers use police crash reports, it's generally felt that this greatly underestimates the problem. There right now isn't any great way to definitively decide if a crash was due to tiredness, so that's why it probably underestimates the problem. However, in February of this year, the AAA Foundation for Traffic Safety released research that analyzed dashboard-mounted camera videos for more than 700 crashes. They scientifically linked the percentage of time the driver's eyes were closed to their level of drowsiness in the 3 minutes before the crash. And their data reported about 10% of crashes involved a sleepy driver. So that's a much higher estimate than the National Highway Traffic Safety Administration numbers, and perhaps that's more accurate. So at what point are you considered a drowsy driver? Sleep experts recommend 7 to 9 hours of sleep per night for adults and a little more than that for teens. But how do you know if you're too tired to drive safely? The National Sleep Foundation states that people who have slept 2 hours or less within a 24-hour period are not fit to operate a vehicle. But that addresses only those who got very little sleep, when many drivers will have problems with a smaller sleep deficit or will have problems due to other factors that make them sleepy. Let's talk about the causes of drowsy driving. So the obvious one is not getting enough sleep. It's estimated that 70 million Americans are short on sleep or suffer sleep disorders. Research from the National Safety Council and Brigham and Women's Hospital showed that about 30% of U.S. workers and 44% of night shift workers report less than 6 hours of sleep on average. You know that the nature of healthcare jobs means that you have to provide round-the-clock coverage and a dedication to your job that often puts work ahead of other priorities like sleep, family, eating right, and exercising. So not getting enough sleep can be a common occurrence. Another cause of drowsy driving is poor quality of sleep. This could be due to sleep disorders such as apnea, insomnia, parasomnias like sleep talking or walking, restless leg syndrome, and other medical conditions that can affect sleep such as chronic pain, lung disease, gastroesophageal reflux, and others. It can also be due to environmental issues such as noises, sirens, alarms, children's noises, pet noises, cell phone alerts. All of these things can be interrupting your sleep, causing you poor quality of sleep. Another reason for drowsy driving is timing or circadian rhythms. So your body has an innate rhythm for sleeping and waking. That is your circadian rhythm. And shift work can throw this off independent of the amount of sleep you get. Note that teens have a delayed circadian rhythm, which causes them to stay up later than during their childhood, but then they need to sleep later to adjust. As most teenagers have to get up early to go to school, the students are then short on sleep, which correlates with higher rates of motor vehicle crashes. A study from the University of Minnesota found that 8 schools in 3 states that switched to a later start time, as recommended by the CDC, resulted in a 70% reduction in the number of teen motor vehicle crashes. Another cause of drowsy driving is medications. And this chart is going to show you the general categories of medications that can cause sleepiness. That's on the left. And then there are other drugs that can cause you to be very alert, but then that could affect your sleepiness when the drugs wear off or when you need to sleep. Okay, psychiatric disorders can also be causes of drowsy driving. For instance, depression is going to make you much more sleepy. And then there's something called sleep inertia, which basically means that it takes time for your brain to adjust when it's awoken unexpectedly. So you might be kind of groggy, even though you just slept. Excuse me. Okay, so let's talk about impairment and how sleep impairs you. So sleepiness and driving is a dangerous combination, much like drinking alcohol and driving. Sleepiness can impair drivers by causing slower reaction times, vision impairment, lapses in judgment, and delays in processing information. So the impairment you experience from sleepiness affects different parts of your brain. For instance, your judgment could be affected. You're so sleepy that you think, even though you've been up all day, 24 hours, you know the way home. You can drive just fine. Because you're sleepy, you're making some poor decisions there. Your memory could be affected, like where did I leave my car keys? Your motor coordination. You could be drifting off the road, having some close calls with hitting other cars. Microsleeps. Let's talk about what a microsleep is for a moment. So a microsleep is where you have a fleeting, uncontrollable, brief episode of sleep. This can last from a single fraction of a second up to a full 10 seconds. Sometimes you have your eyes still open during these. It typically occurs when a sleepy person is trying to fight sleep and remain awake. But it can occur at any time and often without warning. Note that when you've closed your eyes for 3 to 4 seconds, you've traveled the length of a football field at normal driving speeds. Okay, so sleepiness can impair driving abilities as much or more than driving while drunk. Studies show that being awake for more than 20 hours is equivalent to a 0.08 blood alcohol concentration. So we know that driving drunk is bad and it is dangerous and it is illegal. We also know that about most drugs, and I think we're catching on to the issue with distracted, but drowsy needs to be in the same category and thought of the same way. It is a serious risk to driving and should not be done at all, if at all possible. Okay, next I want to show you a video from the National Road Safety Foundation, and this video describes how a young man named Rusty became a paraplegic as the result of drowsy driving.
I had stayed up all night the night before. Where I lived was about 30 miles away, and I thought I was fine. I was wide awake when I dropped her off at her house, and driving home, I fell asleep just a mile mile from home, so I figured a few more minutes I could make it. I'm almost home, and I didn't make it. I crossed the center line, hit a driveway embankment, flipped my car, wasn't wearing a seatbelt, and was thrown through the sunroof. I landed on the highway. In one instant, all my hopes and dreams that I spent 18 years building were gone. None of it included a wheelchair. I remember laying in the hospital bed in intensive care, and a nurse standing over me telling me that I would never walk again, and how my life was going to be changed, and the things that I was no longer going to be able to do. I had to learn how to get dressed. I had to learn how to get in and out of my chair, how to bathe myself. I had to learn how to get around in public, how to go shopping, how to cook. Everything that I had been doing my whole life, I had to learn all over how to do from a wheelchair. And thinking back, I remember lots of warning signs. I remember dozing off numerous times. I remember getting to my girlfriend's house that morning and falling asleep on her couch while she was getting ready. I remember falling asleep at my grandmother's house that evening before I took her home. I had all these warning signs and ignored them all. Because, sure, I've nodded off before, but nothing ever happened. I wasn't doing anything illegal. There's no law against drowsy driving. And it's something that I've done numerous times before, so why would this time be any different? I was just 90 seconds from home and thought I could stay awake for 90 seconds, and I didn't make it. Because of that, my life has changed forever. And now what I want to do is use my experience, use what happened to me, share my story with other people so they won't make the same mistake I did. You cannot change your past, but you can change your future. Regret is the heaviest burden that you will ever bear. I know, because I bear it every day.
All right, well, Rusty named several reasons why his crash was a classic drowsy driving crash. Which of these do you recall from the video? He ran around all day and kept falling asleep. He disregarded earlier warning signs of falling asleep. He hadn't slept in 30 hours. He had no priors. He never had crashed before, so he thought he was invulnerable, and that's certainly related to his age. He crashed late at night as a single car crash. He was alone. He made no attempt to avoid his crash, and no one intervened to say, "You're too tired to drive, don't drive." Okay, the next video covers the story of Tom and what happened to him and his wife on an afternoon drive. It focuses on the warning signs also.
The body is most susceptible to sleep at two periods, between midnight and 6 in the morning and in the middle of the afternoon. The one that's less well known is the one in the middle of the afternoon, which is the one that affected me. I got sleepy, and I knew I was sleepy, but all my life I've been driving. You get sleepy, you get through it. It's that belief that you're going to get through it that kills.
According to the National Highway Traffic Safety Administration, at least 100,000 police-reported crashes each year are the direct result of driver fatigue, resulting in an estimated 71,000 injuries and 1,500 deaths.
You think you're going to get through it this time, and there's no problem. It'll pass. But there are these times when it doesn't, and the consequences can be horrific.
Tom Callaghy, a college professor, knows all too well the dangers of drowsy driving. He and his wife of 33 years were driving back to their home in Pennsylvania. Tom dozed off at the wheel just for an instant and drove into the trees. His wife died in the crash.
Janie was asleep in the front seat, and I didn't want to wake her up. She was tired and happy, and we were on our way home, and I should have, but I didn't. It had been sort of gray overcast all day and drizzle, and the road was gray, and the water was gray, and the trees were gray because there were no leaves on them. The road was straight. There's a profile for these kind of accidents, and all of these conditions fit this type of accident, something I didn't know at the time. And there's the middle of the afternoon in terms of the body rhythm dip. I did all the normal things one does when one gets sleepy while driving. I turned on the radio, I opened the window, those kinds of things. And I was just about at the point where I realized I should stop. And I'd actually sort of started to reach over to wake her up. And it was too late.
Tom believes he fell asleep for just a few seconds, something that happens to most people.
We call those microsleeps. And that microsleep, which could be a second, 2 seconds, 3 seconds, literally they're disconnected.
But if you are traveling 65 miles an hour, in just 3 seconds, you've traveled the length of a football field.
I wasn't speeding, I hadn't been drinking, there was no medication, substance abuse, anything. I just fell asleep. And the car went off the road, sideswiped a bunch of trees, and then finally hit one, and she died instantly.
Crashes like Tom Callaghan's can be prevented. If you're tired, don't drive. And know the signs that you might be falling asleep behind the wheel. They include difficulty focusing, burning eyes or yawning repeatedly, trouble remembering the last few miles driven, feeling restless and irritable, tailgating, missing traffic signs or exits, or hitting rumble strips.
You must absolutely act as soon as you think that you're getting sleepy. You stop, take a nap, you drink some coffee or anything else with caffeine in it. Actually, soft drinks are preferable because you have a definite amount of caffeine in them. Coffee varies enormously. Change drivers, walk around, whatever. But you must absolutely act. If I'd known then what I know now, it simply wouldn't have happened. Janie would still be here. But she's not.
Okay, so that video went over a number of warning signs of drowsiness. A couple of them, hopefully you caught. Difficulty focusing, frequent blinking, heavy eyelids, daydreaming, missing exits or traffic signs, the microsleeps that we talked about, drifting from your lanes, hitting rumble strips, all of those are warning signs. Let's talk about high-risk groups. So these are the high-risk groups as associated with crash reports. Young drivers, ages 16 to 24, are about 80% more likely to be in a drowsy driving crash than other age groups. Males are about 60% more likely to be in a drowsy driving crash than females. Those using sedating medicines, shift workers, and those working multiple jobs, and I'm going to talk a lot more about this in a minute. Those with untreated sleep disorders, and those driving long, high-speed or rural highways, especially at night. But keep in mind, drowsy drivers can be any ethnicity, gender, age, income, educational level, and occupation. Let's talk about shift workers. So a shift worker is anyone who follows a work schedule that is outside of the typical 9-to-5 business day. An estimated 15 million Americans have permanent night shifts or rotating shifts or irregular schedules. Shift workers are more likely to drive while fatigued and almost twice as likely to fall asleep at the wheel as non-shift workers. And rotating shift workers and people working more than 60 hours a week need to be particularly careful. So here is an article from January of this year showing a consequence of a sleepy driver. And in this case, the EMT who was riding in the back was partially ejected and then died from his injuries. We don't know any details about the driver's length of shift or how much sleep the driver got, but you do have a sense of how EMS providers are a high-risk group for not getting enough sleep. Let's look at some of the research about shift workers. More than half of EMS personnel work long hours, like more than 45 hours per week, and most work extended shifts of 12 or 24 hours. And in many locations, people work at multiple jobs. Looking at some of the research, one study by Steele et al., they looked at nearly 1,000 emergency medicine residents in 78 programs, and they asked about their shift schedules, tolerance of night work, ability to overcome drowsiness, and involvement in motor vehicle crashes or near crashes. 8% of the residents reported having been in a crash, and 58% reported involvement in a near crash. Nearly three-fourths of the crashes and 80% of the near crashes followed a night shift, and there was also a correlation between crashes and the number of night shifts worked per month. But what about changes to the work environment to reduce the risk of drowsy driving? It's good to do things at an individual level and important, but what about at the occupational level, the work environment? Well, the Governor's Highway Safety Administration says that hospitals should take steps to ensure their staff do not end up in the emergency room as a result of drowsy driving. And the American Academy of Sleep Medicine says that drowsy driving does start with the individual, but needs to also be a priority for the institution. And they recommend that there be more research to better define the indicators of drowsy driving, more technology and infrastructure to mitigate the effects of drowsy driving. For instance, technology could be a solution in the future for drowsy driving, in that we could have fully automated cars where we just get in and fall asleep and then we wake up when we get home. But that's a ways off. A change to infrastructure to reduce the risk would be, a simple example would be rumble strips on a road where just, they wake you up if you go over them. The American Association of Sleep Medicine also encourages more research on the threshold at which sleepiness becomes dangerous to drivers, and simple methods for any driver to determine when they are too tired to drive safely. Okay, I would like to talk a little bit about something, some research that was just published earlier this year, and it's a project from the National Association of State EMS Officials, who partnered with the University of Pittsburgh researchers, and they did this research with National Highway Traffic Safety Administration funding. What they wanted to do was, they knew that the risks for fatigue were great among the EMS community, and you can see in that purple box lots of things that say how much EMS folks are tired and how it can be linked to safety outcomes. So they looked at over 38,000 research papers about fatigue, and they culled the research to find what was relevant to EMS providers or other healthcare providers or shift workers in similar situations. And they did this to try to come up with some recommendations that could be used to mitigate fatigue in EMS. So they published their results in February in this journal. Here is a very brief summary of their results, and I'm going to go over each of these in a little more detail. So these results, remind you, are not specific to drowsy driving, but they're highly relevant to reducing the problem of drowsy driving, and they are written specifically for EMS, but they're also very relevant to other people who have similar shift-related jobs. So their first recommendation is to use reliable instruments to measure sleepiness and fatigue in EMS personnel. And they recommend that these assessments are provided to high-risk shifts at least quarterly. Second recommendation is that EMS personnel should work shifts shorter than 24 hours in duration. Now, they tried to look at in the research whether an 8-hour shift was preferable to a 12-hour shift to a 24-hour shift, and it was very hard to come up with statements they could make that rose to a level of significance, but they could definitely say that shifts shorter than 24 hours were preferable. They also noted that shifts performed contiguously should be counted as a single shift period with a total duration. The third recommendation was that EMS workers should have access to caffeine as a fatigue countermeasure. So research shows that caffeine use reduces acute fatigue and lessens the slowing of reaction time at the end of a shift. So you still might be slowing down even with drinking coffee, but you're not doing it as much or as fast if you are having caffeine. So they recommend a reasonable availability of caffeinated beverages for free or for purchase while on duty. Now, the thing to keep in mind with caffeine is that if you are overusing it or using it in a way that it's then going to affect when you should sleep, then that causes other problems. So it seems like you need to really tune into what your dosing should be and timing for use of caffeine. The fourth recommendation is that EMS personnel should have the opportunity to nap while on duty. This research did not specify exactly how long the naps should be, only of a short duration. Remember that that if you take too long of a nap, you might wake up really groggy. So the short duration is to avoid that. They recommend that agencies have a written policy about this, an appropriate place to nap, and a scheduled time to nap or an unrestricted opportunity. The last recommendation is that EMS personnel should receive education and training to mitigate fatigue and fatigue-related risks. They recommend that education and training is provided to every new employee as part of orientation, and then every current employee should receive it every 2 years. Okay, so let's talk about recommendations overall. So you can think about this in terms of when you must drive, and then also in terms of preventing drowsy driving episodes. So if you must drive a ride, pull over safely and have a cup of coffee or a caffeinated snack. Allow 20 to 30 minutes for the caffeine to enter your bloodstream before you drive again. A nap alone would also be helpful. Again, you don't want to have a really long nap, so set your watch, your clock, whatever, so you wake up. Another thing you can do is carpool with someone and actively talk with them. That engages your brain in a way that will help keep you awake versus if you're just listening to someone talk, that's not going to be very effective. On long drives, take a break every 100 miles or 2 hours. And of course, do something to refresh yourself, like getting a snack or switching drivers. To avoid drowsy driving situations, make sleep a priority, including making your bedroom a sleep haven and setting a routine. Designate in advance an alternative driver or a ride-share service. Avoid medications when you need to drive. And in general, keep a 2-week sleep diary to monitor your sleep and help identify patterns with your sleep. Okay, as I said, this presentation is adapted from the National Road Safety Foundation, and they have other resources that are listed here. What I'd like to just spend a few quick moments on right now is just a little bit about the other materials that are available on drowsy driving for Maryland healthcare agencies. The campaign can provide social media materials, so we have some really neat Facebook or Twitter messaging, about 15 different messages. We have short public service announcements. We have handouts, 6 different table tents with some nice colors and straightforward messages that work great in hospital cafeterias or coffee shops or staff lounges. We have an incentive magnet, hot cup holders for coffee or tea cups that have the messaging, and we have publishing ready articles and photos. In addition, there's also a display that can be borrowed to put up in your lobby to educate the public. All these are free to Maryland healthcare agencies. So how do you get these? Well, you can contact me at this information. There's my email address and my phone number, and I'd be happy to talk with you more about getting this campaign for your agency. So just to wrap it up, I would like to remind you that Maryland EMS providers can obtain continuing education credit for this presentation if they listen to it fully and answer the quiz and then return it to MIMS along with your provider number. And for other healthcare providers, check with your agency about obtaining any kind of CEUs. Thank you very much.
At this time, I will open the phone so that questions can be asked. I have unmuted all of the attendees. If you have a question for Suzanne, please ask it now. I also want to direct you to the section within the webinar called Handouts, and I have included in there some materials that Suzanne put together from a variety of sources and has made available to all of the participating hospital and EMS agencies in our Drowsy Driving campaign. There's a quick quiz for employees. There are guidelines on fatigue. There is a one-page handout identifying the problem of drowsy driving, and there is a second quiz with the questions that are slightly different. The organizer and staff have checked the question area, and there are no written questions. At this time, I will open the phone one more time for any questions from the audience. Thank you very much for participating in this webinar on drowsy driving, and thank you to Suzanne for sharing the work that has gone on for the last 18 months. We look forward to receiving requests for information and providing you additional webinars in the future. At this time, this ends the webinar.